everyone, welcome to week number 10. So this week we have one chapter to focus on, and that chapter is 36, pages 819 to 823. So this chapter is going to be discussing assisting with the physical exam, but the section that we are specifically looking at is going to focus on the sequence of procedures during a physical exam. Now, you as the medical assistant will need to know the specific order that your physician will use during a physical exam. But for the most part, it will begin with a normal review of the past medical history. That's the part of the history that's going to include all the diseases and medical problems that the patient has experienced within their past. From there, you will move on to the review of the chief complaint, or the reason for the patient's visit today. What brought them in? After that, the physician will move on to the history of the present illness, which will then contain the details about the description of symptoms, such as the onset, duration, and the intensity of each problem. Now, after all of those have been reviewed, the physician will then go on to the review of systems. Now, this is a complete head-to-toe exam that will focus on evaluating the patient's body overall. In the review of systems, you're going to start with looking at the patient's skin. The physician will use inspection and palpate the skin. What we're looking for is any nutritional levels and the hydration level of their skin. That can be told through skin. So after they finish with skin, they're going to move on to looking at the patient's hair. They're going to look at the color, texture, distribution, quantity, and growth pattern. This will help them to determine if there are any conditions that they need to worry about, such as alopecia, which is hair loss, or balding. So skin, hair, and then comes nails. So again, they're looking at the color, texture, size, and shape, and all of those are going to be assessed. What we're looking for is any possible circulatory problems or fungal infections. So after the nails have been examined, the head will be examined. The size, shape, and symmetry will all be assessed. We're also going to have the physician look at the scalp for any parasites, lesions, flakes, or irritations. When they're looking at the head, they will also look at the face of the patient, which can reveal a lot about their state of health and their stress level. Think about if you had bags or black circles around your eyes. That can tell your doctor maybe you haven't been sleeping well, and that could be due to stress. After the head will be examined, we're going to move on to the neck. What we'll do is we will assess the range of motion, the pulses, the texture, color. We're going to look for any lumps or masses and swelling. If there are lumps or masses in the throat, it could be a thyroid disorder. From the neck, we'll move on to assessing the eyes. Now, sometimes prior to a physician exam, the medical assistant may be asked to perform an acuity test. So if you think back to week 2 when we talked about eyes, we talked about there were types of acuity testing you might have to do, such as distance, the farsightedness, nearsightedness, and color vision. The provider will also, at this time, examine the field of vision, along with pupils, the reaction to light, and the structures of the eye itself. From eyes, we'll move to ears and assess the internal and external ear for size, color, shape, and position. They also may perform a hearing acuity test, like the ones that we discussed in Chapter 3 with the tuning fork or the odometer. From ears, we will move on to the nose and assess the internal and external nose. We're going to look for color and symmetry. And the provider may also perform a scent test or sense of smell test. Then the mouth will be examined. We will look at the patient's lips and the inside of the mouth for symmetry, moisture, color, and lesions. Now, while the physician is examining the inside of the mouth, the tongue will also be examined for texture, color, size, shape, symmetry, movement, and position. While also examining the mouth, the throat will be looked at as well. What we will do is have the patient stick out their tongue and say, ah. In doing so, the provider can then examine the uvula, tonsils, and throat for color, size, shape, symmetry, and movement. The provider this time may also perform a gag reflex test, but those are very unlikely. Next, the physician will examine the arms, and this is going to be for joint and pulses. We'll also look at strength and range of motion. After the arms will be the heart, and this will assess the sound of the heart by looking at the rate, rhythm, pitch, and quality. And while we're already looking at the chest cavity with the heart, we will then move to the chest. And what we're doing is actually assessing the symmetry of the patient's chest during breathing. At this time, the provider will also look for any pain, tenderness, lesions, lumps, and the temperature. While we're also looking at the chest, the provider will also assess the spine and note any abnormalities at this time. Since we're in the chest and we're looking at breathing, the next logical place to go would be the lungs. The provider will assess the breath sounds, making sure to note any rate, rhythm, pitch, depth, and location. Again, since we are in the chest, we will move from the lungs to the breasts. This will be assessed in both male and female patients. What the provider will be looking for and assessing is the size, shape, symmetry, and texture while looking for any discharge, lumps, masses, pain, or tenderness. We will then move on to the abdomen from the breasts to assess the symmetry, texture, temperature, and movement. While the provider is examining the abdomen, he will also look for bowel sounds. We'll look at the frequency, pitch, gurgling, or clicking. And because your abdomen is broken up into 4 quadrants, the provider will also listen and tap on organs of each quadrant to look for signs of masses, look for the position of the organ, and the muscle tone and musical tone that it puts out. From the abdomen, the provider will then examine the genitalia. For female patients, that's going to be both the internal and external during a pap smear. For males, the external genitalia will be examined, and then a testicular exam will be performed. From genitalia, we will do the rectum exam, and this will assess for any lesions or masses, or for any occult blood, which is hidden blood not seen with the naked eye. Most physicians will do this after the age of 40, and at age 50, we will start having patients do colonoscopy exams. Legs and feet come next, and what we're doing is looking at the joints and pulses, and we will assess those. We'll also look at the strength and range of motion of both of those items. The final piece that will be examined during a review of system is the neurological system. The provider will assess the reflexes and observe how the patient walks, what their facial expressions are, their sensation responses, and their speech and movements. All right, guys, so that is the overview I have for you on the review of systems. Please make sure that you're reading those few short pages to help you get a better grasp of the material and the knowledge concepts, so that way you are prepared for your discussion board this week and for your lab classes. Now, your discussion board this week is looking at and reviewing the 3 types of review of systems. The 3 types that we will be focusing on are the problem-pertinent review of systems, the extended review of systems, and the complete review of systems. You will need to explain and describe each type in your own words. I say that because you're going to be doing some research on it, and there's an article to help you write it, but I don't want you to just copy and paste. I want to hear it from your own voice. Please make sure that your initial discussion board post is done Tuesday by midnight, and that your 2 classmate responses are completed Saturday by midnight. All right, guys, that is all I have for you. I hope you all have a wonderful week 10 and start preparing yourself for finals. Have a wonderful week, guys. Bye-bye.